I'm Staff Sergeant Grayson Jenkins. Today here we have an M9 aid bag. All right, let's take a look to see what's inside. So as a medic, the very first thing we treat is massive hemorrhage, and we need to apply tourniquets as fast as possible to keep all the blood inside their bodies. So on the sides here, I have 2 tourniquets, along with a pouch on the top with tourniquets as well. And I have as many tourniquets as I possibly need. If I need to add 2 per limb, that allows us to get the best possible chance to stop the bleeding to any extremity. One thing I like to do is everything I need will be in its own individual bag. So here I have my wound packing kit, and I keep 2 of them in here. We'll have our compressed gauze to be able to wipe away any blood. I have my combat gauze to be able to pack any junctional wounds, along with 2 ace wraps to be able to secure it down, and of course tape, because tape is a medic's best friend. I have my respiration kit. So this has hyphen chest seals in it. This seals any wounds on the chest, and I have tape just in case I need to secure those down as well. So the way I have my aid bag set up, massive hemorrhage is the very first thing that we control, and the very second is airway. So I go back up top to the other side to be able to handle airway. So when we're treating airway, we like to go as minimal as possible, and then we can go into more invasive as we need. So I have 2 NPAs. This goes down the nose so we're able to secure their airway. If I am unable to secure their airway, I have a cricothyroidotomy kit. Cricothyroidotomy. What this contains is tape, a scalpel, so I can cut into their throat, and a tube that goes into their throat, and it gets placed right here. And then I have my hook to be able to secure the patient's throat as I place the tube, and then a 10 milliliter syringe to be able to fill the balloon up in that tube to secure it in the person's airway, in their trachea. All right, so after I treat airway, I would then go into respirations. After I've completed respirations, I'd move on to IVs. I would want to get vascular access of my casualty. This allows us to provide them any life-saving fluids or medications that they would need. This is an example of just one IV kit that I've placed together. And we will spread all of this out. So this contains 4 hypodermic needles, my IV 18 gauge catheter needles to get vascular access. I have my 10 milliliter syringes so I can flush any IV as I need to. I have the saline lock itself. This keeps the site there so we're able to use it whenever we need. I have my 2x2 gauze to be able to control any minor bleeding out of an IV site, alcohol swabs to keep it nice and aseptic, and then my IV tubing in case I need to give any fluids through an IV bag. I have tubing here ready to go. I place my tubing, or my fluids, we'll get to this. The fluids can go in the bottom here. And so combat medic can carry a whole variety of different types of fluid. This is just normal saline and a 250 milliliter bag. They can go all the way up to 1,000 milliliters. And combat medic can also carry blood if it's properly stored. Sometimes a combat medic is not able to get intravenous access to a combat casualty, and sometimes we need to get access through their bone. And one thing we use to teach combat medics is this is called the FAST 1. It's a cluster of needles that goes into casualty's chest, and what that does is allow us to push fluids and medications through their actual bone. And this comes with a target patch. So a combat medic must always have a Sharpie on them. So I keep at least 3 in my aid bag, and I keep even more on my person. Everywhere there is a pocket, a combat medic should have tape, and they should have Sharpies to be able to document. Up here I keep my 18 gauge catheter needles, and what this is for is to decompress the chest if a casualty were to have a tension pneumothorax. Last thing, the medic always needs to get vitals and check on response of their casualty. So I have a pen light here. In my aid bag as well, I would have a pulse ox and a blood pressure cuff and stethoscope. This last pouch that I'm opening up is our admin pouch, whether it's medication administration or administration of writing documents. So all combat casualties are documented on a DD form 1380, and most of them will end up being wrinkled like this as it's fit into this very tight bag. So they document all casualties, injuries, all medications given on these cards here with a permanent marker. Also, I have 2 extra rolls of tape just in case. And then I have any medications, and I created some medication kits. Again, it depends on each individual unit SOP of what how they would carry medications in an aid bag. And so we have our 2 10 milliliter vials, alcohol swabs to be able to clean off the site before we administer. And then we have a 5 milliliter syringe for a flush and 2 10 milliliter syringes for the actual medication. And then I have 4 18 gauge hypodermic needles to add to the end of my syringes. Last one, I have simulated an ertapenem pouch. And ertapenem, also known as NVANS, is an antibiotic that every combat casualty must get. With penetrating trauma on the battlefield, there's a lot of nasty germs that a casualty can get, so we need to be giving them as many antibiotics as possible to be able to kill them off. So we have our normal saline, which would be reconstituted in our NVANS or ertapenem, which is a powder form. And then we have the same needles, syringes, and alcohol swabs that we would have for our ketamine. And now you know what a combat medic would carry with them on the battlefield.
Hey, thanks for watching. If you like what you saw, head over to our channel and click the subscribe button. From there, check out our other videos and see what else is going on in the U.S. Army. See you next time.